Hi, I'm Dr. Jim Hoven of Ramos Law, and your host for Health Matters. Today, we're going to talk about injections, specifically ESIs. Stay tuned, learn more. Here we go. Have you ever known someone who's gotten a shot or an injection after an injury? Maybe it's you, maybe it's someone else you know. Well, there's different types of injections, and today we're going to kind of demystify what the ESI, or epidural steroid injection, is. It's one of the safest procedures we can get for people that are having back pain, neck pain, or radiating pain down the arms or legs. I'm going to grab a spine, we're going to talk about it, and I'm going to show you exactly what's going on with an ESI. So when I take our spine, what happens is I'm going to show you where these things live. When nerves get irritated from an injury, it could be in the neck or it could be in the mid-back or low back. These nerves travel from the low back, travel down the legs. And in the neck, they travel down the arms. Well, when those nerves get irritated and they have proteins on them that cause inflammation, it can lead to all kinds of pain and symptoms. So sometimes, especially if the patient hasn't been getting good results with whether it be chiropractic or physical therapy, conservative care, what we'll try is making sure that we get something right inside the space where the nerve lives, a chemical on it, which is typically an anti-inflammatory along with an analgesic. We'll put that chemical on there, and the procedure is called an ESI, or epidural steroid injection. And the way it works is the needle is placed in between the bone and the nerve in the little sac that's protecting the nerve, and then they put the medicine on there and it washes away the proteins that are causing the inflammation, and oftentimes immediately there's a pain relief that now allows that person to go into therapy, into exercise, and start the process of healing. Now, unfortunately, these don't always fix the trick, but what they do is they act as not only a treatment tool, but also a diagnostic tool. For example, if a nerve in the neck were to be damaged from some sort of trauma, and we put the injection in, and by the way, they use an X-ray to guide and see where they're going to inject, then they put a little dye on there to know they're on the right spot, then they put the medicine on there. When the medicine washes the proteins away and it gives an analgesic effect to that nerve, instantly, basically, the person's going to get up and go, oh, I feel better. Now, if they didn't get the right spot, then they won't feel the relief. And so that helps the doctor know exactly which nerve is involved, so that if the pain goes away with the nerve, with extra therapy, that kind of thing, awesome. And so the results can last anywhere from weeks to years. But sometimes when it doesn't last and you do a few of these, you can't keep doing them because it's kind of hard on the system. It kind of breaks down some of the cells in here, whether it be ligaments, tendons, that kind of thing. It starts irritating those, so you can't keep doing these just ad nauseum. So what it'll do is it'll tell them, this is the area that's injured. Now, this is where we have to do our next procedure, our next more aggressive procedure. And then it goes up the ladder to different kinds of things that affect that nerve in a deeper way. So that's a little bit about ESIs. Of course, if you have questions, you can reach out to me, jim@ramoslaw.com. If there's other topics you want to talk about or hear about in these short vignettes, just let me know. Also, if this has been helpful, please share it with someone. Let them know that there is hope, that there's things that we can do for neck and back and arm pain. And we here at Ramos Law work with the best doctors that do this stuff all the time. They're super familiar with it. So we're happy to help you with anything that you need. And remember, your health matters.